Well, hello again, everybody. Today is the 28th of May. Welcome into another Keep Boone Healthy Community Information Channel extravaganza. I am David Jackson, President and CEO of the Boone Area Chamber of Commerce. Thank you again for clicking on this video link. We are pleased to be joined today by the President and CEO of Appalachian Regional Healthcare System, Mr. Chuck Mantooth, gracious enough to spend some of his Friday afternoon with us here today. And Chuck, I know that we have talked several times over the course of this last short period about all of the changes that are going on within the hospital system, both with services offered as well as physical space. So in the midst of a large construction project, I know you all are constantly evaluating how and where you position key resources within the system. So we appreciate you spending some time with us this afternoon to go over some of those things.
Absolutely. Glad to be here. And I hate I'm holding you back from all your Memorial Day activities, David.
Well, hey, you know, the hot dogs are on ice right now, so we'll get there in a moment. But let's talk a little bit about the Broyhill Wellness Center. I know that that's been a source of conversation within the community, a facility and a service that's been one of the hallmark services of Appalachian Regional Healthcare System for decades now, and some potential changes with the use of that facility and how it integrates with other parts of the hospital. So can you kind of give us a broad overview of what you are looking at there, so we can knock down some of the rumor that's out there and get to the actual truth about what you intend to do with that facility and the services that are comprised inside that facility?
Yeah, sure. And I appreciate that. You're exactly right. The rumor mill has been vibrant, I should say. And actually, that's a positive thing. I mean that in a positive sense. To me, that tells me that people care about what's going on over here. And that's really kind of what we want to see. So maybe I'll just take a second and step back and put what we're talking about doing in the Wellness Center in context of kind of where I think this community and even Appalachian Regional is going, moving into the future. The very first thing is I was just sitting here thinking as you were talking about the investment in dollars in about a square mile from where I sit. We're building a $126 million facility that'll come online first part of 2023. Obviously, the College of Health Sciences here put about 85 million in, and then the rec center, which is really kind of the point of what I want to talk about today, 34 million investment by the county. That's over $200 million invested in a period of just less than 5 years towards health and wellness, which I think is a tremendous investment in this community. So now, talking about the rec center, obviously we watched and supported what was going on there because we felt like that what we did, and Richard Sparks and the board that took that big leap of faith over 20 years ago to build a wellness center when not a lot of hospitals or health systems were building wellness centers. Richard and the board saw that as, we need to start moving upstream to keep people healthy and keep them out of the hospital. That's where health and wellness is going. Obviously, it's still continuing to go that direction. So how do we bring that service into our community? It's been a tremendous success. 5,000 members currently. We have a big Silver Sneakers program, which means that the majority of those members are participating in the Silver Sneakers program. But then we watched. There was a need in the community for things beyond what we could provide, from just a wellness and exercise facilities, those type things. The county stepped in. There was tremendous support. The rec center was built. We're glad to see it and be our neighbor there across from State Farm Road. But as it was being built, we started having some internal discussions, not only administrative folks, but the board, about what does that mean for the future of the wellness center. With limited resources, we want to make sure that we used our resources wisely moving forward. So then we started discussions and visioning and planning those activities. And that's really kind of where we are right now. Is we've seen some programs grow, and they need space, and those programs actually kind of cross lines with other programs that we have in the wellness center. And I'll talk specifically about what we're thinking there. But how do we take the square footage that we have at the wellness center, which is about 54,000 square feet? We're blessed to have that much square feet. We wish we had a little bit more parking, but the building's sufficient. And really integrate and take to a higher level what we've been building in separate locations. And specifically, I'll just cut to the chase and talk about what we're thinking about putting in that building. Over the last 3 years, our orthopedic program is doubled in size. It's grown over 200%. and we're out of space in the space that we have here across from the hospital. We've seen at the same time, rehab has grown 162%. I've got a few numbers right here. And then I mentioned the 5,000 wellness center members. At some point in time, and the people cross those lines. A lot of folks that use the wellness center end up, God forbid, they injure themselves, but they want to get back to the wellness center. They have to have surgery, then they have to have rehab, and then they're back at the wellness center. And there's this cycle that's created there. And what we wanted to do was take that concept and see if we couldn't integrate that into one space to really kind of build something that really is, I can't think of anything like it in over 100 miles. So something really kind of special for the community. So we took that concept, and obviously when you start talking about it to the folks involved, like rehab staff, and that floats to wellness center members and folks like that, then rumors are created. And actually that's a good thing, David, because at the same time, that gives us some feedback on what's really important for those folks as we move into the future. Now, I will dispel a few rumors. We are not pouring concrete into the pool in July. We are not closing. But some of the things that we are looking at is the complement of programs that have been really, really successful in, I guess, up to this point, programs that the rec center is doing. And maybe we should let the rec center do some of those and we kind of move in a different direction. But that's all in a planning phase right now. But the main thing is we've got to have some space for our orthopedic program. And that's right in where the pool and the rehab pool and a lot of the locker rooms are right now. So that we are identifying that space from an architectural standpoint to really create that orthopedic clinic that's going to be just futuristic. Now, that doesn't mean that all those things that I mentioned are going away. It just means we have to find other space inside our wellness center to offer those services. So we're going through that phase right now. But as far as the architects are involved, really the only planning is for the orthopedics right now. Because it's so early in the process. And this will likely take months to plan out and just look at our facility and what needs to be put in there. So those are the three concepts that we have that we're trying to work together under one roof. And that's the direction that we're moving. But at the end of the day, what we're trying to do is support the rec center to do what the rec center can do well, and then let us focus on things that we've traditionally done well, change a few things, but really continue to meet the public's need.
Well, and I appreciate that explanation, and can tell you I'm living proof of part of what you just explained. I had a very similar experience. A longtime wellness center member had to have surgery, was able to do prehab, rehab, all under one roof, and back under the care of Tiffany Norman, and all in one facility. So I definitely understand that concept. You mentioned some things that I'd love for you to expand on as we get into some of the trends that you see in orthopedic care and need for more care. I think it times up well with some other numbers that I've heard you talk about before as well, and that is the growing number of seniors in this area. And we see that manifest itself over a number of different things, whether that's second home purchases, the number of people that have come into this community. Are you using some of that data to assess future growth about what you see the need for orthopedic care, just simply because there are more numbers of older residents that are either here or coming here on almost a monthly basis?
Yeah, absolutely, David. I mean, we've used that in our planning documents for 2 to 3 years. And it wasn't really rocket science. You take the baby boomer effect across the country, you magnify that here for the things that you mentioned, the second homes, the transient folks that live in Florida want to live here in the summer. We just kind of naturally seen that as just a part of our community. So we knew that the baby boomer effect would be magnified. So we took that one step further and said, well, okay, folks are going to live longer. What are they going to consume from a health resource standpoint? There's a few things that really stood out. Very first thing is, if you look at that community and that cohort, and I'll be there before too long. I'll be there sooner than you will, David. But so I can kind of share my personal experience. People want to be active, and that's what we encourage. That's what we're trying to do at the Wellness Center. Well, to be active, sometimes it's not like when you were 20 and you recovered really, really easy, and you just kind of need some assistance, joints wear out, and those type of things. So therefore, we saw the tremendous need for orthopedics, and that's represented in our growth and the success we've had there. A couple other areas. Just to go off topic from the wellness center a little bit, but the two leading causes of death are heart disease and cancer, and that's across the country. It's no different here. But what we're seeing is some amazing advancements in the care and treatment in those disease classes, where it's really, let's take cancer for example. A lot of the cancers now are more chronic illness type treatments rather than a one type treatment that either people improved or they didn't. It's kind of I guess the life expectancy has been extended over a period of time. Well, as people live longer, oncology transfers to primary care. You don't need as much oncology, but you still have to have it here because the overall is expanding. So we're investing in our cancer program, our cardiology program, and orthopedics for those reasons. And you nailed it. That was a great way to tee it up. Our community is going to continue to see that segment grow tremendously, and that's the impact that it'll have on us.
So with that said, and you may not be able to know this level of detail, as you said, you're in a planning phase still at this point, but where do you see the wellness center fitting in some of its wellness education? You mentioned cancer, so that immediately makes me think of the Thrive program, some of those things that have been born out of that element of your business, of wellness education and prevention. How do you see that complement working with what's currently offered, what could be brought over by orthopedics, expanded rehab? How do you envision those three playing off of one another to create the scenario that you explained a little bit ago?
Yeah, let me touch on the connection with rehab and orthopedics, and then I'll move into kind of the wellness side and maybe answer that question a little better. But I had elbow surgery 8 years ago or so, and it's probably from throwing and stuff, the things we talked about. And one of the things that was stuck in my mind was I had a great therapist at the wellness center. But what I kept seeing was she'd have to leave me and go call my orthopedic surgeon, and she could get him sometimes she wouldn't. So there's this conversation and connection that needs to be maintained between rehab and the person that actually did the surgery. So to have that under the same umbrella is just valuable. It's invaluable, I guess I should say. And probably sometimes it isn't, can't be accomplished over the phone. Maybe the doctor needs to come down there and take a look at. So that's what we're trying to create from that connection. On the wellness side, this is where it's really, really exciting that we can kind of take, if the rec center, um, folks that want to come and work out on their own and those type things, that may be great for the wellness center, for the rec center, where I feel like that we've gained a lot of traction over time as our people. The facility's 20 years old, but I think a lot of times people come there for the quality of the people and the service they're getting. So how do we preserve that? That will not go away. But specifically to get into a few of the programs, what we'd like to do is we offer like cardiac and pulmonary rehab there. We would like to get into areas that, or like you mentioned, if you're going to have hip or knee surgery, how do we get you ready for that? That's a non-traditional. Insurance usually doesn't pay for that, but we can extend that as a program that we offer at the wellness center. That's a little bit more specific in the care than maybe what the rec center may be able to offer. So that would be our niche that we're looking for. But a basic question is, would general members be able to join the wellness center? Absolutely. We don't see that changing. But we want the members that come there to know that this is what you're going to get when you come to the wellness center. So it would attract a certain population that we're trying to target.
A couple last questions for you, and you just touched on one. Are there any of those kind of, if you were to put out a frequently asked questions document right now? I think we've all heard, again, as the community rumor mill goes, you've addressed some about closing the pool, things like that. Are there any other things from a services provided standpoint, maybe, that you could answer short-term, long-term of yes, this is still something that the wellness center wants to do, or short-term as we evaluate, these are some things that may be counted on by the county or the various other businesses that provide those services to be able to provide to folks that currently use the wellness center for those types of purposes.
Yeah, I mean, I think we're still going to have weights. We're still going to have cardiac equipment, all the services and equipment that you kind of see there. We'll continue to have that because I think there's just an important part of at least the facility side of. From a service standpoint, we have I got to be careful because I don't want things to people to think things are going away when really haven't have gone through the full evaluation. But I'll give you a good example. CrossFit's great. I can't do it. There's a, it's a little bit of a cult, and it's a great thing because people are being active or whatever. My joints couldn't take it, but we have CrossFit taking place in a gym that was built for basketball. So you can kind of see that transition over time, that we have facilities that have been repurposed for something different that's a little more trendy. That's what we want to try to get out ahead of it. What's the next thing that we need to be focused on? How do we take the time now to adequately plan our facilities and lay them out in a way that we're thinking about those things in the future? I can think about, spin classes and, that personal training. I don't really see that changing much. Now, where it's located may change and maybe a little bit more of the focus, but those type things we really want to keep and capture what's really kind of brought us and made us successful here, for 20 years.
A final question then for you, and again, being in an evaluation period, knowing that the train is still gathering steam here, you may be able to answer this, right? But from a timeline perspective, what can people anticipate in terms of some of the benchmarking you're doing, and maybe even how to participate in some of that, or if you plan on doing any of that kind of outreach, versus when do you, in a perfect world, construction timelines being what they are, when would you like to see this facility answering all of the various questions that you foresee it being able to answer from again, the services that you'd like to provide?
Yeah, my wife and other people around me know that I'm impatient, so I'd like to see it tomorrow and get all these questions answered. But I realize we've got to. Yeah, I really want this to be. And again, I know we started this meeting or this call with um, the chatter and rumors. I think it's good because people are concerned, and I want to hear some of that feedback. You and I had a chance before the call to talk a little bit about that, and that's valuable to me because I took some notes. So that process we should be slow to plan. What's the old adage? Measure twice, cut once. So we want to plan appropriately, but we want to move along. Here's the answer to the question. I really like to have the planning phase complete in 6 months. So then we know exactly, and then kind of running concurrently, we would have architects looking as we're planning, have the architects part of that discussion to say, okay, how do we need to adjust from a facility standpoint? So we're not playing catch up when it gets to actually our decision point. So I'd like to do that and then take about a year to reconstruct what we're doing. So in 18 months, I'd like to be in the new reimagined wellness center.
Well, with that said, that times out well with a number of other facility projects that you've got going on the Watauga campus, as well as is up in Avery County. All of those things still progressing along about the way that you thought they would at this point?
They are, and I don't want to get over my skis here, but they're actually going well. The Cannon, the 37-bed behavioral health inpatient facility was actually ahead of schedule and on budget. So from a planning standpoint and operations, that's what you want to see. Out here, we have at Watauga, we're doing really well. We've got good weather. We've got a good contractor in Vinoy construction, and we're progressing well. And we feel like that we're going to hit our mark of March 2023 to bring that facility online.
Hey, when you use a local contractor, they understand local weather trends better than anybody else. So they know how to squeeze those days in for sure.
And how water flows and the rock calls.
That's right. That is right. Well, Chuck, we can't thank you enough for spending some time with us here. It's certainly valuable information, and anytime that we can put the actual source of the truth out there and let that get amongst the community, it's certainly better for everybody. And I agree with you. I think that this whole exercise has shown that a lot of people are loyal to the brand that is Appalachian Regional Healthcare System, and they care about not only the services but the people that make up that the outfit that you are in charge of and positioned so well in the community. So thanks for spending some time on a Friday afternoon, and we hope you have a great Memorial Day weekend.
Thank you, David. All the best.